Hi everyone, I'm Dr. Dionisio here at Platinum Medical Group. I've been a chiropractor for the last 28 years, just to know a little about my background. I'm actually have the pleasure of introducing Dr. Sam from MedLink. Dr. Sam is a naturopath. Let her introduce herself.
Hi there, I'm Dr. Samantha Ramanan, but everyone calls me Dr. Sam. I'm with MedLink Health Solutions, your mobile naturopathic concierge, and now COVID testing medical doctor. And I'm sitting down with Dr. D today to discuss a few common misconceptions about COVID-19 testing and just put out some really clear, accurate information for all you today.
And we're going to talk about some testing options as well. So let's just get started with some key questions. So Dr. Sam, why is it important that we test a symptomatic and an asymptomatic patient for the COVID-19?
So COVID-19 is a relatively new viral infection, and the human immune system really has not seen this virus at all. And so that is why it's so contagious and so many people are becoming symptomatic. However, the symptoms that COVID-19 expresses, so cough, fever, shortness of breath, they're very general symptoms. Any hundreds of bacteria and viruses can cause a dry cough and can lead to pneumonia. So it's very important for us to know the difference, to test symptomatic patients who have those general symptoms and know, is this the COVID-19 virus or is this something else? Does this individual need to go in more isolation, or do they just need to stay home to get well? So that's important for the symptomatic patients. For the asymptomatic patients, this is what makes COVID-19 so tricky, is that patients can express no symptoms but still carry the virus. For whatever reason, that individual is healthy and they don't express any symptoms. However, they carry a viral load and viral antibodies, and they might have contact with an individual that's less fortunate, not as healthy, and spread this virus. So it's really, in my opinion, important that we test absolutely everybody to know what their status is.
So I guess this is a perfect opportunity for me to just interject. My patients just want to know, they got that fear factor, right? They just want to know, do I have it? Did I have it? I just like to know,
Exactly.
Right? That's what we're kind of talking about today. So, and what a great explanation for that. So can you actually tell us about the test itself? What is it that you're doing with the test?
Yes. So the test that I am performing is the COVID-19 rapid test, and here it is right here. It takes about 10 minutes to read. It just requires 1 drop of finger blood. So if you ever had a blood glucose test where you have a little finger poke, a drop of blood, we drop the blood into this well here, put the buffer reagent for the antibodies, and then we wait 10 minutes. So in that time, we will then read this test, which is read similar to a pregnancy test where a line is indicative of a positive result, no line means negative. And what we're testing is 3 different things. So we have our control, always need a control in our in any of our tests to compare to. We have our IgG and our IgM antibodies. And how I like to explain that to patients is that IgM is the first antibody that you produce when you first start to get sick, kind of like that day before when you're feeling like something's coming on, you're producing this antibody, which is not very specific, but it is produced during the time that you have an active infection going on in your body. So that time that you are shedding the virus, that you're most contagious, you have IgM antibodies floating around to this particular virus, COVID-19. IgG antibodies are more related to the late stage of the infection and immunity. So it's much more specific, and it is the antibody that we are trying to detect to see if you have any kind of immunity to the COVID-19 or if you have seen it in the past. So those are the 2 things that we're testing for, your antibodies, whether you have an active infection going on or whether in the past, let's say 30, 45 days that you have come across this infection and cleared it.
Okay, perfect. One of the things I think you and I talked about in the last week or so is there's a lot of employers that are going to want to have their employees that are coming back to work tested. Is this a great format to have that done.
Absolutely. So, and that's what we are trying to get out there, that this rapid test is perfect for employers that want to have that peace of mind that while Arizona and many other states are talking about reopening up May 1st and reopening their non-essential businesses, how do I allow my employees to return to the office and not have that worry that some of these patients are asymptomatic, like we talked about before, spreading this virus? Now we have an explosion of these active patients in office. Everyone goes home. This is a scenario we do not want. So how we're utilizing this specific test is to promote it towards the business owners to test every employee that they have in and out of their office, so that we can say with certainty that you either had it in the past, you cleared it, or that you haven't seen it and that you don't have any antibodies to this particular virus. And interestingly enough, this specific test that we are using, Arizona State Health Department has actually bought up a bunch of these specific tests to test their first responders. So
Wow.
nurses, doctors to return back into the hospital, firefighters, police officers, they're using these rapid tests in order to clear them for active work.
How fantastic is that? So, I mean, we can help anybody that's a single individual that wants peace of mind, or
Absolutely.
small families, or then again, those people that are employee going back to work. Fantastic,
Absolutely.
Dr. Sam. That's great. How accurate is that test compared to, I know you and I talked about the saliva and the nasal swabs that are out there.
Yes. So the nasal swab has gotten a lot of press and news because it was the first test that was deemed the gold standard. And we were utilizing the nasal swab because those were active patients with symptoms, and we were testing them right then and there. But the nasal swab has a lot of limitations. It's only testing for the virus RNA, so it's not testing for your immunity, and it can be missed that you have active infection that's just not showing. So the nasal swab is about 52 to 63% accurate. It misses a lot of positives, unfortunately. With this particular test, the rapid IgG, IgM, it's actually 96% accurate.
Wow.
So we can say with 96% certainty that you do or do not have the virus.
Wow. That's impressive. Okay. Awesome. And then how are we going to use the test exactly? So can you walk me through, like, when a patient comes to, whether it be mobile because you're traveling,
Yes.
Dr. Sam is actually going. If you want that as a service, she'll travel to you. If you want to come to her office, that's an option. You want to come to our office. There's so many ways that we're making this available, but what's the process and procedure that they're going to go in? How safe is this?
Exactly. So safety is our number one priority. Number one, especially being in the healthcare field. We want to all stay healthy. We want to keep you healthy. I need to stay healthy so that we can continue doing good work and testing and giving people peace of mind. So safety is 100% priority. And how this works is usually you can call in either at my office at MedLink or here at Platinum Medical Group and schedule an appointment. We can just take a little bit of your information, phone number, date of birth, and first and last name, and an email. I send you a screening. So I want to know the information prior to showing up. I want to make sure that if you did have a contact with someone who was confirmed COVID-19 positive, then we want to take extra precautions for that individual, or if you have all of the symptoms related to COVID-19. So we first take you would take a screening online and sign that consent, and then send it back to me. Depending on if you are a high risk or a low risk patient, we can either come to your actual home. We'll roll in, take the test, keep our social distancing for 10 minutes, and then we can read the test, and then we can all have peace of mind of whether or not positive or negative, or we need follow-up diagnostic tests. I've done some of these tests just right in as a patient drives up to our clinic. I take the test in a parking lot. We keep our social distance. We wait 10 minutes, and then we read the results. Or also an option is for them to come here as well, and we take the same sort of precautions. Isolate you, take your test, wait 10 minutes, and then read the results. And
so the staff's fully protected.
The staff's fully protected.
The patient's fully protected.
Yes.
Only one person at a time is being tested.
Only one person. Correct. One person at a time. If it's a family of 4, let's say, that we did relatively recently, we had one with us at a time, and then we'd have them go isolate one at a time, and then we test them and we have them go isolate. So we're taking all of those precautions.
Just another, this is kind of, so if my wife and I and my daughter want to get tested, we're going to do that separately. What are the concerns people have in the process? Like, what are the most common questions people are asking while they're waiting to have the results?
All of these questions.
All of these.
Everything that you're asking me, that's all their questions,
all
because
right.
There's so much misinformation out there, and it is confusing because this virus is new and we don't have all the information, and it takes years for us to develop the exact timeline of you come in contact with this virus, how long it takes for you to show symptoms, that you show symptoms, how long does it take for you to build up an immune response? And that is an average of millions of people, and there's a lot that we still just don't know. So they ask questions like the accuracy, what this test really means, what it doesn't, how often should I be tested? Is a good question. So if you're asymptomatic, at least until there is guidelines in place, my recommendation for a place of work would be for 30 days. Until we have more information about this virus and what constitutes actual immunity, I would say every 30 days, get your staff, get yourself tested, make sure that you're not an asymptomatic carrier. And if we all did that, then we could return to normal a little quicker.
Sure. We did an immune health class on Tuesday, had a great response. We answered a lot of questions. We shared some research, some supplements people can take. We want to talk about IV therapy because you've done it on me and my family. So that's an option for people as well. They want to just get a natural boost in their immune system, not wait maybe until they get symptomatic.
Yes,
right?
Exactly. And that's something that we offer mobile as well, and we also will start offering it here in the office as well. But yes, preventative as a naturopathic physician is always the best medicine. We got to be preventative. If we were preventative, we probably wouldn't have gotten as sick as we are right now. So, and there hasn't really been a lot of talk about prevention and immune boosting. So what I do with the IV nutrient therapy, so IV therapy has been around for probably 80 years now. And it's been used widely since about the 1950s. And what I'm utilizing it for is for nutrients. So not drugs or pharmaceuticals that you might think about in the hospitals, but actual nutrients that you need day to day that we should be getting from our diet, like vitamin C, vitamin A, these trace minerals like zinc you hear a lot about. All of these things we should be getting from our food sources, but unfortunately, standard American diet, we often don't get the appropriate amounts of all of those vitamins. And also as a result of poor diet, our absorption is very poor. Mm-hmm. So even if we eat the appropriate amount of greens and vegetables, we might not be absorbing all of those vitamins. Even if you take a supplement, you really are only absorbing about 20% of that supplement, which is why the recommended dose of what people are taking, they need to take like 4 times as high to get the appropriate amount into their system. With IV therapy, we bypass the gut absorption. We get it straight into the body, 100% absorption into the body. With vitamin C is the main one. We're using it preventatively because it goes both ways.
Wow.
Vitamin C is important in your immune system.
That's fantastic. Thanks, Dr. Sam.
Of course.
I guess the last question, if people may be wondering as well, how much does this cost to actually have a test? Can you maybe enlighten us on that?
Sure. So the cost for myself to be mobile and come to your place of business, place of work, it's $149 a test, and we give you all of the codes, the bill associated with that, and then you can submit that for reimbursement with insurance.
Okay. And then if you're making an appointment, whether it be in your clinic or my clinic, it'll be a little less expensive because it's not mobile.
Because it's not
And
mobile.
we'll certainly share
Correct.
that. Okay.
Correct.
Fantastic. I have to say, I've only known Dr. Sam maybe like 6 months. She has a huge heart, very smart lady. I really appreciate our relationship. Thank you for taking this time to do this. It's been enlightening for sure, and we hope people do take advantage of it, and hopefully we're trying to do our best to educate and diminish that fear that's going on in our community. So
absolutely.
Thanks so much for your time.
Thank you for asking all those questions.
Absolutely.
They're all
Thanks.
great, and I think everyone will appreciate having those answers, feeling a little bit more certain of what they should do to be preventative and what they should do to make sure that they are safe and they're doing what's best for their place of business and for their family. So thank you for having me. I hope to be back soon.
And we're definitely going to share our information. So if you guys watch this, you enjoyed it, you think other people will benefit, just like and share this as we pass this along to others. And our contact information will be also at the
And if
bottom
you have
to reach
other
us.
questions that we didn't get into or that we didn't talk about here, just go ahead and please ask. I am a big fan of you asking those questions, even the tough questions, because it's important that you understand what you get and what you don't get. And it's important that you feel confident leaving and you are fully in charge of all of the information that was presented. So please ask your questions below or call us, ask them, and we'll do our best to answer them.